this goes back to, allogeneic stem cell transplant, which is getting a transplant from a donor. And one of the main complications is graft-versus-host disease. And this is when donor T cells or donor immune cells can, affect some target organs that are already weak because of the chemotherapy and can cause some damage. And there has been associations with the microbiome and some of these target organs, particularly the GI tract, and the severity of graft-versus-host disease. So studies in mice have shown that changing or altering the microbiome, which is the good bacteria that live in our gut, as well as the metabolites that are which are byproduct of like bacterial byproduct, can affect graft-versus-host disease. So back in 2016, there was a study in Dr. Pavan Reddy's lab, which showed that mice who died of graft-versus-host disease had a decrease in butyrate level, which is a short-chain fatty acid that is a bacterial byproduct. It's a metabolite. And when butyrate levels were either restored by giving patients, giving mice butyrate, or by giving the mice butyrogenic bacteria that produce butyrate, mice died less of graft-versus-host disease. And then there was a study in humans out of Dr. Tom Schmidt's lab, in healthy students, University of Michigan students, that showed that giving these students a prebiotic in the form of resistant potato starch, so pretty much a food substance, can increase butyrate levels in the stool. So we set out to test this resistant potato starch in patients and allogeneic stem cell transplant recipients. And we wanted to see, can we indeed increase the stool butyrate levels in these patients? So this is the pilot phase that you are referring to. This was published back in October in Nature Medicine. So we had 10 patients undergo this pilot phase of the study where they took resistant potato starch. And we were indeed able to increase the butyrate levels in the stools the way we set out to do. And now we are undergoing a phase 2 study to try to see, well, can this change in the gut bacteria and the butyrate decrease graft-versus-host disease? For the phase 2 study, we are enrolling patients right before they start their conditioning chemotherapy for their transplant. They start the study and they take starch twice a day. They take it in a form of a powder mixed with food all the way until 100 days after the transplant. And we look at their stool levels stool samples to look at butyrate levels at different time points throughout the process of the transplant. And we designed the phase 2 study to be able our hypothesis that we will reduce historical rates of acute graft-versus-host disease from 40% to less than or equal to 25%, so a 15-point reduction. And this is grade 2 to 4 acute graft-versus-host disease at day 100, cumulative incidence at day 100. We are going to enroll a total of 60 patients. In the end, again, this is our primary endpoint would be to reduce graft-versus-host disease. So patients get this prebiotic or resistant potato starch along with their standard of care graft-versus-host disease medicines, prophylactic medicines to prevent. So this is a prevention study to try to prevent graft-versus-host disease after transplant. So next steps, we right now are in the middle of the phase 2 study, and we've enrolled a total of 44 out of 60 patients. So once we're done enrolling, we'd be able to evaluate that whether or not we met our primary endpoint of reducing graft-versus-host disease. Our results thus far are very encouraging, and the results from the published pilot phase, although obviously not powered to look for graft-versus-host disease, were very encouraging because only 1 patient out of 10 developed graft-versus-host disease. So once we are done with the phase 2, we would be able to publish that data. And then the hope is that this would be a cost-effective and a safe approach. As you know, most of medicines to prevent or treat graft-versus-host disease are very immunosuppressive. So this would be cost-effective and safe because it has not caused really barely any side effects, and it does not cause infections. On the contrary, it should help with that aspect as well. So it would be very exciting to be able to use, a prebiotic or a food substance to try to decrease such a deadly complication after allogeneic stem cell transplant, which, as you know, is life-saving for many patients.